Breast augmentation, like all operations, carries its own set of risks that you need to be aware of before you decide to undergo it. And any good hospital, any good surgeon, any good anaesthetist will be doing everything they can to minimize these risks, both in terms of the hospital being well managed, cleanliness, smoothly run, using high quality staff, high quality equipment, high quality implants. From my point of view, what do I do to minimize these risks? I'll do everything I can to ensure that you are fully prepared for surgery, that by the time you start your operation, you're at the optimal point of actually now being ready to have surgery and go through it as safely as possible. So what are these risks? Specific to breast augmentation surgery, there are the typical risks of pain, which actually is not really a risk, it's almost guaranteed. Expect some pain for the first few days, but it does get better. There's a risk of bleeding after surgery, about a 1 in 100 chance that you may need to go back to the operating theatre. I think my numbers are probably better than that looking back over the last few years, but that's the number that I still quote, and that's the typical number that you'll hear. There's about a 1 in 1,000 risk of getting a bad infection. And this is important. If you get an infection in an implant, it may have to be removed in order to get rid of that infection, and then you may have to wait several months before you can have another one put back in again. Then there are the long-term risks with implants. They don't last forever. So do be prepared to have your implants changed in about 15 years' time. This is not going to be your last operation. You may decide to have them removed, or you may decide to have them replaced. And that's typically because of a condition called capsular contracture, which is hardening of the scar tissue around the implant. Capsular contracture is something that happens with all implants eventually, so you need to be prepared for it, and if it does become a problem, you need to be prepared to deal with it. It's where the scar tissue can squeeze the implant, start making things feel harder, feel more painful, potentially uncomfortable, and make things look unusual, and that might be what you end up coming back to have dealt with in 15 or so years' time when you'll need your implants exchanging. If an implant gets a hole in it, what we call a rupture, a bit like a puncture in a tyre, which can happen again with time as they get older, that can go on to cause this hardening, this capsular contracture, and that might be something that brings you back to have implants changed. What I would say is that by coming to a place like the Cadogan and having surgery with somebody like myself and with the anaesthetic and nursing team and all the other adjuncts that we have here, those risks will be minimised to the best of our ability.